Hello everyone, my name is Gorky Rada. I'm a med student from UCSG, Guayaquil, Ecuador, and today I have the pleasure to be talking to you about Inclisiran for homozygous familial hypercholesterolemia. We'll start by a brief definition of the disease. So, familial hypercholesterolemia, also known as FH, is a syndrome which is characterized by an elevated level of low-density lipoprotein cholesterol, known by its initials LDL. This syndrome has its LDL in a range greater than 600 milligrams per deciliter, and also shows an increased risk of premature atherosclerotic cardiovascular disease. Next, we'll continue with the etiology of the disease. So, etiology. Homozygous familial hypercholesterolemia, known as HoFH, is an autosomal codominant disease resulting from mutations in both copies of the low-density lipoprotein receptor gene, known as LDLR, as I mentioned previously. Characteristics. It affects both genders equally. It doesn't have a preference for gender. It's also a rare genetic disorder which only affects 1 in every 250 people. And people with this disease or disorder have a high risk of developing early coronary artery disease. Next, we'll be looking into a video of an introduction about FH.
Familial hypercholesterolemia, or FH, is a genetic disorder characterized by greatly increased LDL levels and a family history of premature atherosclerosis. Normally, LDL receptors on liver cells help clear LDL particles from the bloodstream. FH may be caused by any of over 1,000 specific mutations that affect 3 known genes. More than 80% of these mutations increase LDL levels by causing the LDL receptors on hepatocytes to either be functionally altered or underexpressed, decreasing the body's ability to clear LDL from the bloodstream. The result of either scenario is an increased plasma concentration of LDL particles. In addition, impaired LDL uptake also decreases the cholesterol pool in the liver, which stimulates hepatic cholesterol synthesis and the production of VLDL, a precursor lipoprotein to LDL. These defects found in FH can result in an increased concentration of LDL particles starting early in life. Sustained exposure to high LDL levels and increased deposition of cholesterol into the artery walls over time elevate the risk of atherosclerosis and premature cardiovascular disease associated with FH, making early detection of this genetic disorder of critical importance.
Next, we'll be looking into the genetics of the disease. So, genetics characteristics. There is a gene mutation in both genes that this slide shows. First, there is a mutation of function loss in the LDL receptor gene, known as LDLR, and the PCSK9 protein.
The relationship between cholesterol and events is the best documented relationship in medicine. We have massive evidence, so we understand the molecular basis of the disease very precisely. And then next, we know that the transmission is dominant. So it's not like skipping a generation, or it's doing that in this individual and that's not true. It's doing the same in every individual. It's raising LDL cholesterol. And so the next thing, the treatment is also very precise.
Familial hypercholesterolemia is really one of the best examples within all of medicine, where we have a prevalence that's reasonably common, a population health impact that's substantial, and most importantly, we can actually do something. So I think that combination really makes FH unique within genomic medicine.
For any given observed LDL, it turns out that FH mutation carriers are at substantially increased risk, and this is an important premise for a genotype first paradigm. For example, if we look at those in the 190 to 220 range, no mutation, substantially increased risk, 5-fold increased risk compared to those with the normal cholesterol. But if you had a cholesterol in that range and an FH mutation as well, you were born with a more than 17-fold increased risk of having a heart attack. And the most interesting thing about this slide is that this pattern persisted even among those with a normal LDL cholesterol. And remember that in a phenotype-first approach, these individuals would have never have been identified because their circulating cholesterol was normal.
And so I think this really demonstrates the value of genetic testing in patient care, and in terms of how we can identify patients and make sure they get the best treatment to help attenuate that increased risk.
So next we'll be looking into the applications in medicine. So the applications in medicine for FH. We'll be talking about Inclisiran treatment. Inclisiran is a small interfering RNA that blocks hepatic synthesis of PCSK9 protein. Orion 9 was a double-blind, randomized, placebo-controlled trial that was conducted in 8 countries at 46 sites. Among 482 adults who took part in the study, 242 received Inclisiran sodium 300 milligrams or matching placebo on days 1, 90, 270, and 450. So it was used at 4 intervals. The percent change in the LDL cholesterol level from baseline to day 510 was decreased in the Inclisiran group. It was decreased by a percentage of 39.7 or 59 milligrams per deciliter. So it showed great improvement. And it showed an increase in the placebo group, showing an increase of LDL levels in 8.2%. So results were that Inclisiran was associated with lower levels of total cholesterol, non-HDL cholesterol, apolipoprotein B, and triglycerides than placebo, along with higher HDL cholesterol levels. Signs and symptoms. Signs and symptoms of FH are vital for diagnosing the disease. So we have these 3 signs. First, we'll take a look into tendinous symptoma, which is the thickening of and later fat deposits of the extension tendons. It usually happens before 10 years old. Another sign is xanthelasma, which is a yellowish deposit of cholesterol underneath the skin, and it usually occurs on or around the eyelids. And finally, arcus cornealis, which is a corneal circle of lipid deposits parallel to the limbus that usually affects both eyes symmetrically, as you can see on the pictures. These are very common signs of FH. So next, we have pros and cons. First, we'll be talking about pros. So pros. Inclisiran treatment showed a great improvement in lowering LDL-C levels, as I showed you. The drug shows great reduction in administration intervals and also improved results being compared to other drugs that were used in this treatment. So Inclisiran, in the end, shows that it's the best alternative to treatment of FH. And cons. So cons. Homozygous FH manifests during early life, usually under 20 years old, which lowers the quality of life of patients. And these young patients can suffer cardiovascular disease early in life due to high cholesterol levels. Issues applied in Ecuador. According to the results of the Ministry of Public Health of Ecuador in 2014, the incidence of FH in a group of people ranging from 10 to 59 years old consists of 19.9% to 20.5% in men and a lower 19.2% in women. And finally, conclusion. Homozygous FH is a rare genetic inherited syndrome that develops early in life and decreases life quality by developing a series of rare complications, which are usually cardiovascular for young people. Inclisiran treatment for FH patients shows great development in lowering LDL-C levels, significantly improving prognosis of the patient. While it's not a common issue in Ecuador, it's vital to diagnose FH as soon as possible, as this will also improve prognosis of the patient. It was a pleasure to talk to you. Have a nice day, and thank you for your attention.